So the current status of PI3 kinase inhibitors in CLL is that we do still have the FDA-approved drugs Idelalisib and Duvelisib available. We don't have data on their activity in the setting of patients whose disease has progressed on BTK inhibitors and Venetoclax, but that is clearly the setting in which we'd be inclined to contemplate them or think about them, because they are FDA-approved, available, and those patients really don't have other FDA-approved options. So it actually seems that it might be important to try to get data in that setting with the PI3 kinase inhibitors, but there hasn't really been much effort in that regard. There are some newer drugs that have been in clinical trials, but the landscape for development through the FDA with PI3 kinase inhibitors has become quite challenging, and that is discouraging some companies from continuing to pursue this line of inquiry. Personally, I do think it's quite important that we continue to evaluate this pathway, and one thing that we've been doing at our place is to use it in combination with Venetoclax to try to extend the duration of Venetoclax in patients who previously progressed on BTK inhibitor. We know that Venetoclax by itself only has about a 2-year PFS in that setting, and we've actually found much higher undetectable MRD rates when we've added Duvelisib, for example, compared to what we were getting otherwise. So hopefully more clinical trials like that will continue to go on, and maybe we'll accumulate more real-world experience of the drugs in this refractory patient population.